This is Dr. Nandini Nelivigi, a senior consultant orthodontist, Director Nelivigi Dental Clinic, Bellandur, Bangalore. Today we will talk about the wisdom teeth or the third molars. Now the permanent dentition has three sets of molars, first, second and third molars. The third molars are what are called wisdom teeth. They usually erupt in the late teens, say 18 years plus. But many a times they get impacted. So what does impaction mean? When a tooth is not able to completely erupt into occlusion, it is called impaction. Impaction can be of various kinds. There is something called a horizontal impaction, a vertical impaction, a mesioangular impaction or a distoangular impaction. Now in any of these situations, the tooth may need to be removed because the tooth is unable to erupt into the oral cavity. Now what are the problems that a patient can face because of a wisdom tooth? 1. Pain. As the tooth is erupting and it doesn't have enough space to erupt, it tends to cause pain to the patient. The pain may not be a continuous pain for a very long time, but it can come in repeated episodes. 2. If the tooth is partially erupted, that is a portion of the tooth seen in the oral cavity, and brushing becomes a really difficult task in that area. So what happens? Food lodgement and all this begins. So bad breath also can be one of the causes of it. And third thing is when food debris gets accumulated in the area, it can cause a decay of the tooth. One other problem that it can cause is something called cheek biting. When the tooth is placed facing the outside of the jaw, then whenever a patient bites, cheek can come and get caught between the upper and lower tooth. So these are some of the reasons why a person or a patient will approach a dentist regarding the third molar. So in these situations, it is always advisable to get the third molars removed. Many a times we do not extract the third molar only in situations where they are completely not seen in the oral cavity at all. But if a portion of it gets seen in the oral cavity, it would always be advisable to get them removed. Now, removal procedure, how is it done? The tooth is first clinically and radiologically evaluated. Many a times the root of the tooth can be very close to what is called a mandibular canal, which carries the blood vessels and nerves. In this situation, a specialized scan called CBCT scan may be advised. Once all of this is evaluated, a surgical excision of this tooth is planned. So a local anesthesia injection is given, the total area becomes numb, the patient does not feel any pain. An incision is given on the soft tissue, it is reflected to expose the tooth. Many a times the tooth cannot be taken out as a whole, wherein a small trench has to be made in the bone so that it eases the removal of the tooth. Sometimes the tooth may also have to be cut or split into pieces to be taken out. Once the tooth is taken out, the soft tissue is always sutured back, and then the patient is given post-operative instructions like you have to keep biting on the gauze piece hard for about half an hour to 45 minutes. Do not spit or swallow your blood or saliva. Do not eat anything hard, hot or spicy for a day or two, and do not do any rigorous exercise like say gymming, swimming and all that. And also please do not use any wind blowing instruments or blowing a balloon, things like that. And the wound should heal up pretty well. Usually the post-operative problems that can happen is some amount of pain is always inevitable post-surgically once the local anesthesia effect wears off. There can be a small amount of swelling developing the following day, which may increase for a day or two and then starts reducing. And you can also have a restricted mouth opening because the tooth is placed way at the back and we would have worked in the area. The mouth opening becomes slightly restricted. You are instructed, or you will be instructed, to keep opening the mouth beyond your comfort level every day a little more so that it comes back to the normal opening at the earliest. Usually 3 to 5 days would be the recovery period. Some people may require a little more time also. However, getting the third molar removed when it is partially exposed is always a good idea because it will at least prevent you from developing a cavity in the adjacent tooth. Otherwise, many times it so happens that not just the wisdom tooth but the tooth in front of it, which is called the second molar, also decays. So be wise, use your wisdom to get your wisdom tooth off. Thank you so much.